Hi everyone, this is Dr. Farida Rajan Ibrahim Omasundi, and today we are going to talk about peptic ulcer disease. So, peptic ulcer disease is a condition that is characterized by open sores that develop on the inner lining of the stomach as well as the upper part of the small intestine or the duodenum. So, that's just a general overview of the definition of what peptic ulcer disease is. So we have mainly two types of peptic ulcers. We have those that occur in the stomach that we refer to as gastric ulcers, and those that develop in the first part of the small intestine or the duodenum that we call the duodenal ulcers. So those are basically two types of peptic ulcers: gastric ulcers as well as duodenal ulcers. So what then is the etiology? So we have various causes, which include the first common one being the H. pylori infection. So the H. pylori is a gram-negative bacterium, and this bacterium will colonize the stomach lining, which will disrupt mucus production and increase acid secretion. So once it colonizes the stomach lining, there will be a decrease in mucus secretion and an increase in acid production. So that's just how the H. pylori infection works. So we can also have the use of non-steroidal anti-inflammatory drugs such as ibuprofen. So these drugs will mostly inhibit prostaglandins that will ultimately reduce mucus and bicarbonate production, and this will make the stomach lining more vulnerable to acid damage. So the overuse of non-steroidal anti-inflammatory drugs also have adverse effects that can lead to the production of peptic ulcer disease. We have things such as conditions such as the Zollinger-Ellison syndrome, which can also cause peptic ulcers. So this is a gastrin secreting tumor, and it can lead to excessive acid production, leading to an ulcer. We have lifestyle factors that can contribute as well. So we have things such as smoking, excessive alcohol consumption, and there are other factors that are not directly causing the ulcers but may worsen or aggravate them. So these factors include things such as stress and eating spicy foods. So stress and eating spicy foods also contribute to the production of peptic ulcer disease, as well as smoking and excessive alcohol consumption. So what then is the clinical manifestation or the symptoms? So the most common symptom we see in this patient is epigastric pain, which can be burning in nature, and this pain mostly will worsen on an empty stomach. So there are situations where you give the patient food, and then if the pain is minimal when you it's relieved when you offer food, you suspect duodenal ulcers. But then when you give food and the pain continues or excruciates, so in that case you suspect gastric ulcers. So these patients can also experience nocturnal pain. You can also have bloating and belching, nausea and vomiting, as well as loss of appetite, which can also lead to weight loss. So coming to the complications of peptic ulcer disease, you have things such as gastrointestinal bleeding, which is the most common complication we see. So they can be the vomiting of blood or the patient passing black tarry stools. So another complication is perforation, and this can lead to peritonitis, which is in most cases a surgical emergency. So you can also have an obstruction occurring, mainly due to chronic inflammation and scarring, which can lead to bloating and vomiting. And sometimes chronic H. pylori infection is also a risk factor for developing gastric adenocarcinoma. Yeah, so increased risk of gastric cancer is also one of the complications that might arise from this condition. Yeah, so that is those are just some of the complications that we see in peptic ulcer disease. Thank you so much for watching. Like, subscribe, and share. Just make sure you watch the upcoming video. Thank you.